Hi, my name is Michael Balsam, one of the founders of a company called NextPHR. Our business is all about shortening the distance between people with chronic illnesses and those in their care network. As our nation continues to spend resources managing illness, we're simply treating the symptom and kicking the wellness can down the road. To cure the underlying program, we have to switch our focus to managing health, and we think we have a pretty good handle on how to make this happen. Power to the patient. In our journey thus far, we've learned that at its core, individual healthcare is anything but an individual issue. When we step back to consider who influences our personal health, each of us has a network that extends far beyond our primary care providers, a team of people we trust. It includes friends, family members, and others who share the same condition. It could also include a naturopath, a personal trainer, or an acupuncturist, and it often extends to a trusted organization like a house of worship. People need to trust their healthcare partners, not just their doctors, but anyone or any organization with whom they share details about their health or seek advice and support. What's been missing is a way to harness the power of these trusted relationships for the benefit of all. We believe the opportunity to change the face of illness management lies in social participatory care, where people are empowered by access to their health information and dynamic social support, along with the tools required to support better outcomes. So in June, we launched the NextPHR Social Health Engine and pointed it at a hypertension awareness and intervention program designed to reach high-risk individuals through a faith-based community. The initial results are compelling and demonstrate the power of social participatory care. So how exactly does this work? Let's check it out. The story begins with culturally relevant educational materials presented under the purview of a trusted community organization such as a church. Messaging reflects the power of community and encourages individuals to participate. Individuals select or create their community organization. As members join, the forum to share and communicate grows. Once connected to a community, participants complete a brief health assessment. This information is used to help us make lifestyle recommendations. It can also be shared with others in your community if you choose to do so. For those that choose to actively manage their hypertension, we help them track their measurements and benchmark against normal values and those of the community at large. This type of visibility provides context and serves to help motivate participants to improve their health. For those of us that take medication, it's often difficult to remember what meds we do take. This information is rarely in one central location that can be accessed by individuals or those in our care networks in the event of an emergency. There are times when we all need help remembering to take better care of ourselves, especially when it comes to taking medication or measures such as blood pressure. So, we provide alerts and reminders to help participants manage their chronic conditions. And we often need a secure way to share information with our family, friends, and caregivers, or vice versa. Traditional email is not appropriate for sharing health information, so we have created a secure, audited messaging system. We also make it easy for folks to participate through their mobile devices. SMS or text messaging is an ideal way to remind individuals to take their measurements or medication. It's also a great way to capture responses, so we are aware of those who may need additional assistance. And it wouldn't be social if you couldn't share information with those in your care network, such as family, friends, and caregivers. Participants choose what to share and with whom to share, all through a simple, secure, and HIPAA-compliant dashboard. So, we'd like to leverage our learnings and our success in New York and expand this program to 4 other major cities: Chicago, Baltimore, San Diego, and Tulsa. Working with public and private partners, we will recruit 1,000 people at high risk for hypertension in each city and provide the awareness, education, and tools to help them lead healthier lives. We will demonstrate on a grander scale the opportunity to save lives through social participatory care. We have an ambitious goal, and we need your support. Demonstration projects like ours stand to change the face of chronic illness in this nation, and we believe this change begins with social participatory care. Thank you for your time, and power to the patient.